I think there are two aspects to that. And I think there are also some positive aspects, if positive in a very, probably it's a wrong word to even use in the setting of COVID, but I think we've shifted a couple of things which will last. And one of this is that we do more telemedicine, which is certainly which my patients really like, if they don't have to come into a clinic and we can do things remotely for routine visit. And I think those are things that will probably last. There's also been a trend towards more oral treatments, and we saw the approval of oral Decitabine last year. And that's something that it's very, very appealing to maybe do an oral Decitabine with venetoclax, for example, but that's something that needs to be validated. We do know that the oral Decitabine and the parenteral Decitabine are bioequivalent formulations, but no one has ever studied the oral Decitabine in the combination with venetoclax. So that's something that would make theoretical sense, but we don't have any data to support that. And that's even more so the case with the oral azacitidine, which is not bioequivalent to the injectable form. So that's something that could be interesting to study in the future. And then what we need to make sure for our patients is, if we've been doing bone marrow transplants for the last, I think we stopped doing transplants for a couple of weeks about a year ago, when our hospital was pretty much at surge capacity, and no one really knew what the impact on so severely immunocompromised patients will be. Well, I think we've caught up with the transplants so far. But if there's obviously been a delay in transplants, those patients, transplant is still the therapeutic modality with the highest potential of cure. Those patients should undergo transplant if they are eligible. And then obviously there was probably a disruption to clinical trial operations. Phase 1 clinical trials where we did pharmacodynamic, pharmacokinetic studies, and those need to be revamped again. But it's difficult for me to say what was the actual impact, because I don't think we really know yet at this point. But I think there's certainly been a shift to keep patients out of the hospital, to do more ambulatory or treatments, maybe entirely oral regimens. And I think this is a trend that will probably continue, where we need some more data to support those approaches.